Well, good afternoon, everybody. Um, Unfortunately, I'm not here with an inspirational speech today. I'm here with a problem. And the problem is a big one. How big, you ask? Well, it pertains to 5 billion people. Billion as in with a B, bravo. And what's the problem? The problem is they do not have access to safe, affordable, and high-quality surgical care. My name is Dr. Gaurav Deshpande, and I'm the Associate Vice President of Medical Oversight and Safety with Operation Smile. I'm also a craniofacial surgeon. For those of you who don't know Operation Smile, we are a global nonprofit, and we are actually trying to close this gap by building a resilient local health force who can then take care of their own children and their own patients. The problem is big. But let's get back to that. It's not just important that these patients get access to high-quality care. Care, but it should be high-quality care. It should be safe care. In surgery, we have a saying that the first chance is the best chance that you have. When you screw up first time, it's very difficult for the second person to correct it. I want to tell you a story. This is about a young boy whom I met in a very small village in the state of Maharashtra. Let's call him Rohit. And Rohit was around 14 years old when I met him. He had a very complex facial cleft. His parents were really, really motivated, and they took him to the nearest hospital where they thought the care was available. Unfortunately, the surgery did not go that well, and he was left with a big scar. They tried again. It didn't go well again. The scar was even worse. They tried one more time, the same thing. And now Rohit has this huge scar, which is, making him target of a lot of bullying. He's calm, he's quiet, he hardly speaks. And the worst part is, the village calls him Bhoot, which literally translates into ghost. When I met him and at this camp, he was again very shy and not talking much. He probably was thinking, here is one more surgeon from the big city with his fancy hairstyle. I had a little more hair that time, and Brill cream was still in vogue that time. But anyways, promising the world to me that, I'm going to take care of you. I was able to convince him. So we took him to Mumbai, where we operated him. And luckily, this time, the surgery went well. Rohit is still in touch with me. He is almost finishing his engineering school now. He got new friends. He got, the kind of nice attention that he always wanted, and he excelled. That's him. That's him when I saw him. And this is the fairly recent photo of him. He was not able to close his eyes, and that caused, corneal aberrations that you can see in his eyes. Coming back to the same thing, Rohit is one of the cases, but there are hundreds and thousands of Rohits around the world. And my point was that, providing surgical access is great, but outcomes are also so important. And we take it very seriously in Operation Smile. What we do is we've partnered with Microsoft's AI for Good initiative, because we do more than 20,000 operations a year in more than 39 countries. So it's impossible for us to physically see each and every photo. So AI is doing that for us now. What we do is, Microsoft helped us develop a very no-frill mobile application. We just take a picture. It tells us two things. One is, how many number of surgeries would this patient need to, get him the complete care. That helps us to plan how much care we need to provide. But the second thing that it does for us is, it also tells us how the outcome was. So if there are surgeons who are getting relatively bad outcomes, we tell them, okay, you need more training so that your quality can improve and your outcomes can improve. On the other end of the spectrum, we have the people who are getting consistently great results, great outcomes. Why can't they be educators and help us train the next generation in these low and middle income countries where there are probably 1 or 2 surgeons catering to millions of people, the problem is big. So they can be an educator to teach this local force who can then take care of their own people. So, we are trying to build the local sustainability. The problem is big, and I keep saying that because we can't do this alone. Surgical access is a human right. And now we have data, we have the technology, and we have global collaborations. But we need your help. We need inventors, we need investors, we need system thinkers who can work with us and make sure that there are no more Rohits who will be ghosted by the society. Thank you so much for your time and attention.